everyone. Welcome back to another episode of Medical Care Redefined. Today is a hot topic. It's one of my favorites. It's about hormone therapy. A lot of our patients come in and Dr. Nguyen gets to treat them for hormone therapy because they were having symptoms of like hot flashes and fatigue and trouble concentrating. And after we treat their hormones, they come back to us and they're like, wow, I feel so much better. More like my younger self. I feel great. And so I think this is such a fun topic to talk about because it is kind of a life-changing thing. And maybe to start us off, Dr. Nguyen, tell us like why you decided to approach hormone therapy and put that part of the membership package and why you practice that medicine.
Yeah, so when I was in residency, we were all very scared of hormone therapy. It's because we were taught that it can cause cancer. And there was a article came out with the Women's Health Initiation in the 2000s saying that, oral birth control or oral hormone replacement can cause blood clot and can cause cancer, which is true to an aspect. And so we were also scared and never really prescribe anything, and we just kind of prescribe symptom control. So if they're depressed, give them antidepressant. If they had hot flash, give them medicine just to kind of for that particular symptoms. We never really treat the underlying cause, and because we were just afraid to. And and I got into obesity. I'm board certified in family medicine, but when I got into obesity medicine, kind of practicing a lot of weight management, and I'm always one that really want to help my patient lose a weight and keep it off and whatnot. And so there's a group of patients in the female patients where they are in menopause, and no matter what I do, I give them weight loss medicine, they eat right, they exercise, they're doing everything that they should be doing in me as a board certified obesity medicine doctor can do for them. And they just can't lose weight, or they lose the weight and they gain it back. I myself was frustrated as a provider, why can I not help this patient? And they're doing everything I've asked them to do. And the big thing was the hormone imbalance. And same thing with the men. So then the men, same thing, as they get older, they lose the testosterone, and testosterone is a metabolism for hormone for men too. And they were having issues of losing weight. And so I was like, okay, there's something more to this than just being scared of the hormone and not knowing anything about it. And so that was kind of the big thing, where my patients were having symptoms and they just can't lose weight. And so I got into wanting to understand more. I say maybe I might not do hormone replacement, but I should, as a physician, should understand enough to at least tell my patient we should or shouldn't do it, right? And so, and they were getting hormone replacement in other places, but weren't managing properly. And so that's when I was like, okay, I really need to understand this. So I started with the American Association of Anti-Aging, the A4M program, and I just wanted to learn. I took a lot of CME. I went to a lot of conferences because I really want to understand. And it was very complex, especially the women hormones. It's you got estrogen, you got progesterone, you get testosterone, and you got DHEA, you got all these things. And it was very confusing for me. But I really took the time to really learn it, because I believe that if I really understand it, then and I trust in it, then I can provide better care for my patient. And there was a whole nother layer of medicine that we just kind of avoid and scared of. And there was many physicians that's doing it right and is changing their patients' lives. And so that's when I decided to take it on and starting to learn more. Initially, I was a little hesitant to do a little bit. And then over time, I learned more. And I feel like now it's where I'm still learning, but we've gotten to a point where we are actually changing patients' lives on a daily basis. And it really does make me satisfied as a doctor, and we're doing it in a safe way.
Yeah, I love that. I think a lot of our patients come in with even very complex hormone problems that you're able to kind of, understand and kind of tackle from different perspectives too, with the knowledge that you have. I think though we need to break down hormone therapy to patients who probably have never really heard about hormones before. So let's kind of talk about some of the symptoms. Obviously, males and females have different types of symptoms. Mm-hmm. What are some of the key things that you think people should look for if they feel like maybe they have hormone imbalance?
So for women, usually, so there's a few hormones, but with these, where we call their sex hormones. So in women, usually late 30s or beginning of 40s, testosterone will drop first. So testosterone is a metabolism hormone. So testosterone, a lot of women doesn't think that it's necessary for them because it's only a men thing. But women, we don't need as much as men, but we need some of it. So the testosterone, when your testosterone's low in women, you'll have symptoms of feeling tired, fatigued, low libido, decrease in energy, lack of motivation. And then you tend to start to gain weight. You gain weight on the central area of the stomach, and you work out and you don't feel like your muscles is gaining. So you kind of have this like body of changing, like increase in the girth area in the arms and stuff gets a little skinnier.
Yeah.
And that's kind of the body of changing of the hormone change. So testosterone will drop first. And then in their 40s or like 45 or so, you start to drop progesterone. Progesterone is the other hormone that can cause like hot flashes, not sleeping well. The third hormone that usually will drop in their 50s or so when fully menopause kicks in is estrogen. Then you can kind of, estrogen is important for like brain clarity, for memory, for sharpness. And so when you start to realize, it's like, did I lock the door? What's that person's name? When I leave my key? Memory starts to kind of like, you're not getting memory loss, but you're not as sharp as you used to be.
Yeah.
And then you start to see wrinkles on your face because you're losing collagen. So then that starts aging, starts to come in. So though, and getting really moody. So like sometimes we get angry or sad for no reason, like watching a commercial and then you start crying. And that's like, okay, that's a sign. So overall, like symptoms of like tired, fatigue, low libido, decrease in energy, hot flashes, moodiness, like those are kind of symptoms of like the female hormones start to change. I mean, and it's hormone replacement is not for everybody, of course. So, but I do recommend just like getting it checked first and talk to your provider about it. Not every physician is that comfortable with hormone replacement. So I would recommend like finding somebody who's functional medicine, who understand and kind of like truly know what they're doing versus, because we do get a lot of patients like, I have all these symptoms, I go tell my doctor and they do the blood work and they said it's all normal. And I think that I'm not saying that the doctors doesn't know, it's just they didn't get a chance to be able to learn and educate themselves about functional medicine yet. And that's the reason why they say that. But you just find one that really understands.
What about males then? Like, what are some of the symptoms that you want to look out for that?
Yeah, so male, usually, so males, you guys, slow down on testosterone production around 40. So 40 years old is when you kind of start to feel some of these symptoms. So after 40, you can have feeling of like tiredness, fatigued, same thing, low libido, weight gain, brain fog, like all those things are symptoms of low testosterone in male. And so if you have those symptoms, then you want to get it checked. And male is particular to check when we check your labs because it fluctuates throughout the day. Usually I'll tell my male patient when they check their testosterone to check it before 10 in the morning because that's where the level is most stable. And we just use that as a gauging number if they're not on any therapy.
Hi, everyone. Thank you so much for tuning into our podcast episode. This is just a friendly reminder that our membership is as low as $85 a month for all your primary, urgent, and emergent care needs, as well as personalized services in weight loss and hormone replacement therapy. Here is a testimony from one of our DPC Health family members.
So hi, I'm Monica. I've been a patient here for actually a year. I did have a health issue with my hormones. They were out of balance. And the doctor recommended we do the pellet, and she said it would be the best thing for me. So we did that. And it worked out very well for me. It helped with my hair because I was having thinning hair. I didn't have any energy. I was always tired, and she explained the side effects, and certainly those were my main concerns. But none of those were an issue. So I have more energy now. My hair is starting to grow back, and I didn't have like a lot of facial hair or breakout like I thought I would. And so I've been very happy with the results.
Yeah, so I think just kind of like think about this in just easy terms. I think common things that we hear about from patients that maybe you are experiencing hormone imbalance is that one, you're not as sharp as you used to be, right? You can't remember small things, your keys, where you put something at somebody's name. Also, you feel like you can't lose any weight. I think that's pretty common too, right? And then also, if you just feel tired, like I think for no reason you sleep enough, you do all these things, but like at the end of the day, like middle of the day, you're still feeling so fatigued. I think those are pretty common, right? For patients to kind of look out for, to kind of start having the discussion about hormones.
Yeah, and it doesn't mean that you may be hormone imbalance. It may be, your vitamin D is off and whatnot. We want to look at all the factors, and if everything that we look at that potentially could be normal is abnormal, is normal, then we want to look, okay, is it your hormone imbalancing? So I think it's something to look at. You shouldn't just avoid it at all, but it doesn't mean that you need it though, but it's an ideal to look at it.
Yes, and I think we need to change our focus onto like, okay, what are some of the treatment options available? Because I think, some clinics out there only specify in doing one thing, whether it's pellets or injections or, this or that. And so we provide a different variety of options, and there's different reasons why you provide it. Can you shine some light about those kind of things?
So let's start with the male, right? Like, I know we always ladies first, but let's start with the male. Because a lot of the misconception is that if the testosterone's low, they need to get injected testosterone. And a lot of guys who work out at the gym, their buddies get testosterone online or whatever. So just get this bottle and just inject it and you get, so that happens a lot, right? The problem with that is that you're not getting monitored. And if you're really young, like in your 20s or 30s or below 40s, and you still want to have kids, you definitely don't want to get exogenous testosterone. So thinking of it like, so your body don't have testosterone, now you're giving, or like low, right? But you're giving exogenous testosterone, then the body be like, oh, I'm not producing anymore, and also decreases sperm count. So in young men who still wants to have kids, even if you're 40 and you still want to have kids, you don't want to use exogenous testosterone as a way of replacing, because then it can cause your fertility status and changing the size of your testicles and all that stuff. So, but in the younger male, I like using, if possible, using something to naturally increase their own testosterone, which means it doesn't harm them, just kind of like increasing that brain production. So like Clomid, HCG, those are things that naturally increase the testosterone production. That's kind of the way I would do it in a younger male. In a male that is like 45, 50, and they're potentially still want to have kids, I could still use that. And sometimes they don't want to have kids, but we want to naturally increase it. We can always try that first. And then if that doesn't work, then I use exogenous testosterone. So exogenous testosterone comes in a cream form that they can apply on the skin. We do come in an injection form. Injections you could do sub-Q, like which is under the muscles. I mean under the like right under the skin, and then the intramuscular under the muscles. And then the timing of it is also different. The way that we manage it, we look at it so that we don't have side effects of like how often we give the shots and all that, looking at their blood work and all and their PSA and all that stuff to kind of make sure they're safe. And then their third option is the pellet therapy. Pellet therapy is where we actually do a procedure and we put the pellet in the glute or the love handle and pretty much giving them a testosterone reservoir, and then the testosterone then will slowly release over the next 3 to 6 months.
Yes.
But they don't have to worry about the injection or the cream or anything like that. So there's different options, but it also depends on that patient. Like where are they at? What are their goals? Are they scared of needles, or they're okay with needles? So all those things help us determine the treatment plan for a patient. And it needs to be specific, right? Like, so if they're doing this form, it doesn't work out, what are their other options for them? So that's the men form of treatment. And then women, I don't do oral estrogen or oral testosterone at all, because oral estrogen, like I've talked about the WHO criteria or the WHI studies, is that the oral estrogen has, and it's very complex to talk into this, but E1, which is estrone, that increases blood clot and in cancer in oral estrogen because that's E1. Now E2 and E3 is the other form of estrogen that is safe. It's neutral, and it also even cancer protective. And that E2 and E3 can only be in a cream form or a pellet form or a patch form, like transdermal form. So I don't prescribe any oral estrogen because that does increase that. That is true. But the cream and the topical version is very safe. And then testosterone also. Testosterone in women, I like the cream or the pellet is because it's a steady release. It doesn't have the peaks and trough. So in women, I don't like testosterone injection that much, because like they need so little amount that we give injection. It kind of has that up and down, and so the result they have like, oh, I feel great, you're good, and then I feel bad, I feel good and feel bad. So it's not as easily stable. So the cream or the pellet has this little more steady, so it's a little bit better.
Something has come to mind. Like, I think one thing I want to discuss, because I know a patient has called and talked to me about, and I had to ask you, is even in your pellets, you're mostly putting in testosterone and estrogen for patients, especially females, and then you're supplementing progesterone capsules for patients who are female to kind of get the whole hormone panel, which there's more to the hormone panel that you're testing other than testosterone and estrogen that I do want to talk about. But a patient came to me and she was like, hey, I get progesterone pellets as well. And she's like, why doesn't your doctor do that? And I had to have that discussion with you. And I think that you had a great answer. So kind of shedding light into that too, like why is it that, you supplement capsules and medications over like putting a pellet in?
So progesterone, we can do it as a pellet or a cream version, but progesterone, if the patient is progesterone deficient and sleep is a problem, the oral version of the progesterone helps with the sleeping pattern. So if they don't have sleep problem, then that's fine, but that we can do the cream or the pellet. But if they're insomnia, which most patients with low progesterone will not sleep throughout the night, and the pill form is better for that, and it does not cause cancer in that aspect.
Yeah, and then I didn't even follow up with you on this patient, but over the holidays I had a patient that called me and she's like, I'm not feeling right, and they're treating me with estradiol something, and they've never even did lab work. And I was like, what do you mean they never did lab work? So I had her come in so that she could see you. But there's more than just testosterone and estrogen that you're testing on patients. Can you talk about some of the other lab work, what you're looking for, and like how you treat those hormones?
Yeah, so when we look at things, I always like to look at things as a big picture, right? And so I think that even in residency, when we were learning about hormones, when somebody's not learning it as a big picture, they're only like, okay, they're menopause, they don't have estrogen, so just give oral estradiol without balancing the progesterone. And a lot of, like, if you ever heard, like, if you don't have, the reason why some of the old physicians put patient on progesterone is to protect them from having uterine cancer without the estrogen. Like, if they're giving estrogen, they have to give the progesterone to protect if they have a uterus. So if a patient doesn't have a uterus, what they're doing is they're not giving progesterone at all, just estrogen. But the problem is these hormones needs to balance with each other. Estrogen need to be balanced with progesterone and testosterone. All three need to be balanced. When you're just giving one without the other, they may help with one symptoms, but it's not balanced. So because the progesterone is not only, yes, uterine protection, but it also helps with sleep and mood balancing. So if you don't have it, it's kind of all over the place. And that's why patients don't feel well, right? And that's the issue with that. And so when I look at labs, I kind of look at everything as a whole for that matter. The other big lab that I like to look at is DHEA. A lot of people who doesn't understand function don't even know what that is. DHEA is a mother precursor hormone to the sex hormone. So if it is low, one of the things we could do is just increase that. When I talk about the mother precursor, think of it like the flour to the cookie, right? If you have the cookie, but you don't have enough flour to make the cookie, then you don't have a lot of cookie, right? So when the DHA is low, I always kind of want to increase is mother precursor, meaning the flour, to make sure it could naturally increase as much of our own hormone as possible. That's why I always start the DHEA. DHEA also can help decrease the stress hormone. That's why it's important, because that's the other thing. The other thing I check in, testosterone is I check like total testosterone, free testosterone, meaning, and then sex binding globulin. What does all that mean? When we talk about total testosterone, is testosterone overall as a whole. And then you have these, what we call sex binding globulin. It's like a binding protein that it takes the testosterone that you do have and lock it down. So it kind of like as a chain. So the testosterone that is functional is actually the one that's free, that's not chained to anything. So when we have too much of this binding globulin, then there's not enough, even though your total testosterone is fine, but you don't have a lot of the free testosterone, then you may still have symptoms of low testosterone, even though your overall testosterone is normal. So in those patients, instead of me replacing their testosterone, my goal is then to lower their binding protein.
Gotcha.
Does that make sense?
Yes.
So to lower the binding, so then you have more free. So in those cases, then the way to lower binding protein is like if the person is a lot of stress, that would cause increase in sex binding globulin. So don't stress out. It's not good for anything. So lower your stress level. And then exercise, eating healthy will lower binding protein, like yoga, all those things can do that. But supplements like boron, magnesium, calcium, those are things that can help lower the binding protein also. So I kind of like, as I do this, I kind of look at everything, right? It's just not just replacing, but what else can we do to kind of overall optimize your hormone? Not just like replacing it all, but what are the other things that we need to do to improve those factors?
Yeah, and just in general, I think testosterone has, not testosterone, but hormones in general has so many factors factors in your body's function. And so I think, patients kind of start, like, they don't think about it. And so then they like get nervous and they don't want to come in to get hormone therapy. I guess just to kind of top us off, what do you think are some of the misconceptions that people have with hormone therapy? Like, why are they so scared to like give it a try?
So it's because, like I talked about, like, the Women's Health Initiation came out with the article that it can cause cancer and blood clots. Like, anybody hear that? Like, I don't want to have that. I'm just going to suffer through this, right? But it's not being explained properly. Why were those patients with that? It's because they were it was given the wrong type of replacement. So when we talked about bioidentical hormone, meaning the hormone molecule looking exactly the same as our body so that it would look the same and function the same. When people miss the conception of, I want to be natural, right? So natural hormone from plant or from animal, it's natural, but it doesn't look like our molecule. So it can potentially still cause cancer because it's not the same molecule as our body. So understanding what it is you're getting, what is bioidentical, like, so that's why it's important. In men, the misconception is that it's not because, I mean, I love the guys out there that like want to improve their health, but like when you're getting testosterone in the black market or wherever you get it, Mexico, Canada, whatever, and you're injecting and you're not monitoring the blood work, that's where we get a problem. Testosterone, when you get too much of it, what does it do? It increases red blood cell production. So it gets too thick in the blood. So it then can cause them, to have high blood pressure, can have a stroke and heart attack. Why is it thickens up the vessel? Anything can do that, right? So if testosterone or hormone is rebalanced properly and we're monitoring it, not allowing that to happen, then they can overall feel better, brain clarity, more muscles, less fat, function better, being younger without the risk of having all those things if it's being monitored properly. And so I wish it could, people can understand it and physician can understand to monitor patient properly, then we wouldn't have a lot of these misconceptions, right?
Before we listen to our next patient testimony, we just want to remind you that DPC Health is available for small businesses too. As a small business owner, you can contribute as much or as little as you want towards your membership for your employees. We also provide mobile services so we can come on site to your workplace whenever you need us to. Let us be your medical team and doctor at DPC Health, where medical care is redefined.
My name is Kendall Chevalier. I've been with DPC Health for years. The reason I like DPC Health is the easy access. As a family of 8 with 6 children, I'm able to call, get in same day. With insurance doctors, that wasn't the case. We'd be waiting months, weeks, or just be told to go to urgent care. Other thing I enjoy about DPC is the hormone treatment, having low levels. Now for years, I've had my levels right. My energy's higher. Dr. Nguyen and the team, they do a great job. Also, in the past 6 to 8 months, I've been able to lose approximately 35 to 40 pounds through their treatment. I wouldn't have it any other way, and I don't plan on going anywhere.
So I also want to address this because, Dr. Nguyen and I are pretty much like family, and I have a grandma who was diagnosed with Alzheimer's disease, and so you kind of approached me and was like, hey, we need to start looking into your mom and like other people in your family members with hormone imbalance because you think it's all interconnected. Like, let's talk about that because I think that's a common thing that nobody talks about.
Yeah. So like in women, we lose estrogen and we lose testosterone, right? And estrogen is important for that brain clarity, that sharpness I always talk about. When you don't remember where you lose things. And especially if somebody have a family history of Alzheimer's and dementia and your hormones is low and it's not being managed, that makes that Alzheimer's and dementia like amplify even more. So those patients like really need to kind of get it monitored or treated to prevent that. And men, the same thing. And low testosterone can cause Alzheimer's and dementia as they get older. Now, once they get Alzheimer's and dementia and they come to me for hormone replacement, unfortunately, that's a little too late. Like I can't reverse it. But if you have it early enough, it can help prevent from like aggravating it early.
That makes sense, yeah. And then also on the other end of spectrums, I think like a lot of younger women, they're on like birth control and whatnot. Like, should they be worried that they're losing their hormones as they get older? Or like what is that topic
So,
like?
most providers and myself, I did not know this until I started like functional medicine and understanding more that birth control, if you are like in a lot of like Americans or in general, right? We start birth control at like 16 years old, and like 26 is 10 years. Like if you're taking birth control more than 10 years or like more than a few years, what it does is it tells our body that we're pregnant, and then it stops producing like the sex hormone. So testosterone starts to decrease its production. In your 20s, you still feel fine, but then like later 30s, like early 30s, you can start feeling the testosterone dropping. And what does that mean? Like tired, fatigue, low libido, decrease in energy, weight gain. All those are low symptoms of testosterone, and it's a lot earlier than somebody who's not on birth control. So birth control, you got to be really mindful, because nobody tells you this. And I didn't even know it when I was prescribing birth control in my younger years of being a physician. But since I understand that, I always kind of have this conversation with my young patients. It's like, hey, do it because you need it, but then, think about it. If you don't really need the birth control, then we can kind of use different options. So different options are like IUDs are a little bit better, because it's more it's just in the uterus, not systemic, so that might be a little bit better. So like even the copper IUD would be a little bit better too. So those are things to consider.
Yeah, and sometimes it's hard because sometimes patients like use birth control just to treat like some of their symptoms too, of just like, moodiness and whatnot, or acne or whatever. So it's just like a lot to consider as like you get older and whatnot. I guess for patients who maybe have never been on birth control, pretty normal their whole life, they start reaching that age of menopause. What are some of the things that you feel like patients should look out for to know like, hey, this is time to have this conversation about hormones?
Yeah, so like I mentioned, like if they are starting to gain weight and they're doing everything that they can, that's usually the one thing, like, Dr. Wynn, I've done everything I can. I can't lose weight, right? That's one. And then like if they're starting to feel like more fatigued, that's kind of common. Like you're just not motivated. Like I know I need to work out, but I don't have the motivation to do that. Start to kind of gain belly fat, and no matter what you do, you can't get that improvement. And then you're just like not really want to be with your significant other. I think that's a big deal. Like we don't want to talk about it as the women. We kind of feel embarrassed, right, to talk about like I don't want to have intimacy, but that's just, and not that you don't love the other person, it's just you don't have the hormones to wanting it anymore. And it becomes a problem for a lot of marriages, because there sometimes intimacy just to satisfy the other partner, but they don't feel it. So if you're feeling those things and it's not your fault, then just get it checked. I mean, it doesn't hurt. And we talk about that conversation. I know it's very uncomfortable for a lot of women because it's embarrassing, but you should be able to talk to your provider, whomever is evaluating for it.
Now, would you say there's anyone that wouldn't be a good candidate for hormone therapy? Like people who probably you're like, hey, like we're going to try other options. This is not it.
So patients who have breast cancer or testicular cancer, right? So if they so the hormone, when it's bioidentical, it doesn't actually cause cancer. However, if they have active cancer, it can feed the cancer. And if they have cancer that was like estrogen dominant or caused from estrogen, it can increase that. And same thing with men. If they, even though testosterone treatment doesn't cause cancer, but if they have cancer, then the testosterone can feed that cancer. And so therefore, those are the type of patients that I would not treat.
Yeah. And I guess just to circle it all back, because, weight loss is kind of your big thing too. Now that patients are treating their hormones, how does that play a factor into their weight? Like what do you see the changes in a patient with weight loss for that?
So I always say hormone replacement or rebalancing is not a weight loss treatment, because hormone replacement alone does not help you lose weight by itself. But it is a key component to the weight loss, because if your hindering piece is hormone imbalance and you don't balance that, you can eat right, exercise, weight loss medicine, and you're not losing weight or you're going to gain it back. But this rebalancing allows you to lose the weight and keep it off.
Gotcha.
And that's what that balancing, that's why I always kind of like, I'm so grateful for what we do, is because we are definitely different. We're not a weight loss clinic. We're not a hormone clinic. We kind of do a little bit of everything. We do what the patient needs. And that's like, because our goal is to optimize their health, right?
That makes sense. Yeah. So just to kind of summarize, like obviously hormones play a lot of factors in your body. If you feel like you're off just by a little bit, like maybe get your hormones tracked and make sure that you have someone who's being able to educate and provide you with the right treatment options. Because I think the thing as we get older is we blame things on old age, but that's not the case. Like you can definitely get treated. You can feel like yourself all over again as long as you get in front of the right doctor. So thank you, Dr. Wynn, for all your information. Check us out next time at DPC Health, where medical care is redefined.